Hi guys. We get a lot of questions around here about orthodontics and orthodontics in general, and in particular, recently a lot more questions about clear aligner therapy, Invisalign and ClearCorrect. We provided conventional orthodontics for many years in our office, and in the last number of years we've really concentrated more on the clear aligner therapy. Some of the differences are that clear aligner therapy is a digitally based platform where the doctor will design the case online and then produce a series of aligners. In general, they're much more comfortable to wear than traditional braces, and we find the patients have a feeling of comfort wearing these. What would you like to add?
I think a lot of questions come from adult patients wondering if they are still a candidate for orthodontics. A lot of times orthodontics is thought to be a teenage treatment, and that's not the case anymore. Adults can benefit from clear aligners. A lot of adults have had relapse after having orthodontics as a teenager, and now they want a beautiful smile. So clear aligner therapy is an invisible way, a very convenient way for them to straighten their teeth and to have a beautiful and healthier smile overall.
I say it's also easy and rewarding for most of the patients. They're excited about it, and they're usually very excited to have everything be finished up and have a great smile at the end. So
We do have patients ask about the cost of the therapy, and there are quite a variety of costs. I guess in general we'd say that it is very similar in cost to traditional braces. Hard to give any real general measurements, but we can tell you that more in the office.
we treat a variety of ages, as was previously mentioned. Teens up through adults, even 60, 70-year-olds can benefit from this treatment. So it's very accessible.
I think what's going to provide success for the patient in clear aligner therapy is being committed to wearing aligners 22 hours a day. So it is a dedication, definitely have to be on board with that. And then coming in every 4 to 6 weeks for general checkups with the dentist to make sure things are progressing nicely and to move on to your next set of aligners.
We find that the aligner therapy sometimes can move along a little more quickly than conventional orthodontics. It's really gratifying for us to see patients come in on these checkups and see how quickly they can move along, and there's a real excitement in the patients as we start to see their teeth straighten out.
Average treatment time is 12 months to 18 months, but it varies quite a bit from person to person.
Really depends on what we're trying to correct. There are quite a variety of things that we correct with it. By far the most common would be some anterior crowding for patients. But we see bite corrections, facial shape corrections that can be done also.
I think patients are always wondering, does it hurt? And I guess I would say that when you first get an aligner, the very first couple aligners in a series might be tenderness. You might feel tenderness or pressure, I think is how patients describe it. And that's very normal. We're putting pressure on the teeth in order to move them. So as you move through the series of aligners, that pressure becomes less and less, and most patients find that it's very tolerable.
To get started on treatment, we typically will do a digital scan of our patients. We used to do GUI impressions back in the day, and now we do digital scans so that we can create a 3D image of the patient's mouth. Many times we'll need an x-ray or two to be able to evaluate the jaw structure, and then a little bit of time with the dentist to diagnose the case.
We want to make sure everyone has a healthy mouth before getting started. No periodontal disease, cavities, no infections.